Alzheimer's disease is on the rise. Cases are projected to triple by 2050. And with that, the need for caregivers increases. And it's a tremendous responsibility, one that Dan Gasby understands well. His wife, restaurateur, author, and former TV host B. Smith suffers from Alzheimer's. Also with us this morning, Doctor Alireza Atri. Good morning to both of you this morning.
Good morning, Mike. Thanks for having us.
Thank you.
Dan, I want to start with you because her fans will want to know, how is B doing this morning? How's she doing today?
You know, she's on a regimen of exercise. She's on medication. She's doing well. But look, let's be real. I mean, we're here to say Alzheimer's is a daunting task. And so, you know, we're taking it one day, one moment at a time. She's in good spirits.
Great. That's good to hear. Well, how would you describe your experience in taking care of her?
Mike, the easiest way is you have a situation where you understand that the greatest thing you can do is, or the greatest language you have to learn dealing with a patient, a person with Alzheimer's, is the language of patience. And so you have to understand, like getting in an airplane and flying from one place to another, you're going to have bumps, you're going to have rough air, but you sort of understand that the plane will land and that you have to be the pilot in this case and find smooth air. And so you understand that you take it not personally when things are not the way they should be or something goes awry. You understand it's the Alzheimer's that is doing it and it's not the person. And you have to be able to separate between what you know the person is and what the disease is making the person act out. So you're able to better manage yourself and understand that this is something that will change and evolve, and that the most important thing is to give that person comfort, a sense of security and dignity. Yeah,
that makes a lot of sense. Doctor, I want to get to you for a second.
Sure.
You know, Alzheimer's affects so many people. I guess, what are the symptoms that people should look for that maybe aren't to the point that B's at right now?
Yeah. So, Mike, it's true. It's different from normal aging, and generally, as we age, we slow down in processing, so we may not remember a name when we want to or a word, but generally it comes to us again. In Alzheimer's disease, it's a slow progression, but there can be momentary confusions. There can be difficulty learning new tasks, being repetitive in conversations, forgetting events in your life, becoming more disorganized, becoming withdrawn. And, you know, people tend to go through this for many years before they get the diagnosis and care they need. So it's really, really important to actually go see a clinician, because the condition can be caused by different things, and also medications can be involved that can have side effects, etc. So it's important to pair that away for people to get the care they need, which includes education, supporting the caregiver, and a medication regimen.
Yeah,
and one of the things I want to make sure that people understand is that we have a wonderful program out here that the Caregiving Action Network is doing, taking photos and mementos of Alzheimer's and allowing people to feel good about themselves. Please check out caregivingactionnetwork.org for information.
And then there's that Take One Moment campaign, and we didn't get to touch a lot on that, but they can get to that through the website as well, I'm sure. Guys, thanks for joining us this morning. I know it's an important issue, affects a lot of people out there, and send our best to B, wouldn't you please?
Thank you very much, will do, Mike.
Thank you for having us, Mike.
All righty, tomorrow a tribute to one